All right. Well, with that, we will go ahead and get started. All right. Well, welcome everyone to our bi-monthly community conversations event hosted by the Oregon Office of Rural Health. Today, we're focusing on our office's rural EMS workforce recruitment and retention programs. I'm Sarah Anderson, and I'm the Director of Field Services at the Oregon Office of Rural Health, and I'm joined today by our Rural EMS Program Coordinator, Joan Field. And we also have a guest, Brittany, from Oregon's Hero Kids program, who will speak a little later in our program. Before we get started, I'll go over a few logistics. The audio has been muted for all attendees. You can select the ellipses on the right of your screen to populate the chat feature, and please use this chat feature to ask your questions. We'll monitor the chat for questions and ask them at the end of our presentation. You may also raise your hand by clicking on the hand at the bottom of the screen, and we will ask you to unmute yourself so you can ask your question live. The presentation slides and recording will be posted shortly after the session on ORH's website at the link on the slide, and we'll put that in the chat in a moment as well. All right, so getting into the content today, I wanted to begin with this map to give you an idea of what rural looks like in Oregon. This slide shows our state's remote or frontier regions in dark green, our rural areas in a lighter green, and the yellow circles show our urban areas. Oregon's population is about 4.3 million people, and 33% of our population live in rural communities. I also think it's interesting to note that 86.3% of Oregon's land mass is rural. And since we're here to discuss the Oregon Office of Rural Health support for rural EMS, I'd like to show you a map of the rural EMS system in Oregon. Oregon has 104 licensed rural transporting EMS agencies, which are critical to assuring access to health care in rural Oregon. Of those 104 transporting agencies, 84 operate in rural and 20 in remote or frontier ambulance service areas. As with the hospitals they transport to, the size of these EMS agencies' coverage areas presents steep challenges. Coupled with a heavy reliance on volunteer personnel and fluctuating resources, many agencies struggle to remain operational. Remote or frontier demographic challenges also make recruiting replacements difficult. When there are candidates among the fewer than 6 residents per square mile, which is the definition for remote or frontier, they must often travel to another county, sometimes 2 hours each way, primarily at their own expense, to complete training and certification to provide EMS services. The Oregon Office of Rural Health has a long history of supporting rural EMS agencies in the state. Recognizing the struggle for rural EMS agencies, especially volunteer agencies, to provide training to their staff to keep their skills up to date, we started the Apple a Day program in 2010. This program, which has since been renamed to the Helping EMS in Rural Oregon or HERO program, provides mini grants of up to $2,500 each to rural EMS agencies to support in-house training or to partially cover the training costs of EMS providers. Grants are made each spring, and since 2010, we've granted funds to over 300 individuals and agencies with over $335,000 awarded. Our most recent cycle closed a few weeks ago, and we're in the process of making 8 new awards as we speak. During the COVID-19 pandemic, ORH was able to find one-off funds to support healthcare agencies and facilities in 2022 and 2023. Understanding the difficulty rural EMS agencies have in terms of affording or finding grants for new equipment, we decided to provide the majority of these funds to support EMS agencies with equipment grants. Over 2 years, and with the support of the Roundhouse Foundation, we were able to provide 12 equipment grants totaling over $218,000. These grants supported rural EMS agencies in purchasing a variety of equipment, including automatic chest compressors, training equipment, cardiac monitors, and more. For the past 20 years, ORH has been a recipient of the Medicare Rural Hospital Flexibility Program, or FLEX, which is a grant program from HRSA's Federal Office of Rural Health Policy. This program originally began to help rural hospitals convert to critical access hospital status, and the program operates in 45 states across the country. Since its inception, the program has evolved and now focuses on supporting critical access hospitals and rural health clinics to improve the quality of care, improve their finances and operations, and overall community health. In 2018, the Flex program added EMS as a category that state flex programs could focus on. ORH was able to utilize a portion of its flex funds to support critical access hospital and EMS partnered emergency simulations, which are progressive scenarios that allow CAS and EMS staff to practice skills during a one-day event to prepare for emergencies they really get the opportunity to practice and prepare for. Since 2019, we've supported 2 simulations per year, and the state EMS office has supported 1 per year. Scenarios can focus on any emergency that keeps the hospital and EMS staff up at night, but most recently have focused on maternal emergencies. Through Flex, we also provided scholarships to EMS providers to attend national and state conferences to support their continuing education. In 2005, 2005, the Oregon legislature passed Senate Bill 31, which grants up to $250 in personal income tax credit to eligible EMS providers who volunteer their services within eligible rural Oregon communities. To be eligible for the tax credit, individuals must be an EMS provider, so EMR, EMT Basic, Advanced EMT, EMT Intermediate, or paramedic, and licensed by the state of Oregon. They must provide services in a rural area and provide at least 20% of their EMS service providing time, including standby, response, and training time on a volunteer basis. I'll note that there are hyperlinks to here on the tax credit programs in the chat and also on the slides. Again, the slides will be available on our website soon. So in recognition of our long-term work to support Oregon's rural and remote EMS agencies, and with the knowledge that we would have the opportunity to apply for a supplement to our Medicare Rural Hospital Flexibility Program, or FLEX, to focus on EMS workforce recruitment and retention, ORH conducted a needs assessment of rural and remote agencies in late 2023 and early 2024. This assessment was completed through the combination of an online survey and interviews conducted virtually with agencies. Although the results were not surprising, they gave us the opportunity to more formally study the challenges and barriers we heard about from our rural EMS agency partners, and they provided us with information we needed to craft an application that truly responded to the needs of our EMS agencies. And so now I'm going to go through the results of what we found. 87.1% of respondents to our needs assessment identified obtaining equipment as a challenge. They identified a high demand for ambulances, command vehicles, AEDs, and cardiac leads, among other equipment needs. Further, 86% of agencies said they must fundraise to purchase essential equipment. Unfortunately, the Flex grant doesn't allow us to pay for equipment, so we could not necessarily meet that need. Workforce recruitment and retention, kind of switching gears there, 65% of agencies cited workforce recruitment challenges, while 64% cited retention challenges. Only 18% of agencies reported that they had the adequate staffing for all emergency calls. They said the barriers to recruiting EMS providers include long hours, training requirements, and reliance on an aging volunteer pool. Excuse me, I'm getting a notice from my computer that I need to enable content. In terms of retention-specific issues, agencies cited a heavy reliance on volunteers, as Oregon's EMS providers are comprised of 57.2% volunteers compared to the national average of 38.1%. Additionally, volunteers often face barriers to training access and financial strain, including travel and tuition costs. Further, retention is hindered by scheduling conflicts, burnout, and a lack of accessible continuing education. A final challenge identified is the support the agencies are able to offer for training. So while some agencies offer support, or excuse me, the support they're able to offer their staff for retention, while some agencies offer support such as flexibility and career track opportunities, most rely on non-monetary incentives such as small tokens of appreciation. Continuing on, 65% of respondents to the needs assessment cited EMS staff training as barriers, saying that training is often not locally available and is costly. They also said they were unaware of any hybrid, so virtual and in-person skills-based EMT courses where their staff, and currently their staff, or at the time, their staff must travel distances that exceed 2.5 hours one way to receive initial EMT education. Finally, 65% of agencies said they had billing and coding challenges, which impact their sustainability and ability to retain providers. They said they lack staff training and resources to optimize reimbursement, and often billing and coding is managed by EMS personnel as a secondary duty, especially in volunteer-led agencies. So ORH built its program activities for the Medicare Rural Hospital Flexibility Program EMS Supplement Grant based on the needs assessment that it conducted, and I went through the results for in the previous slides. And we submitted a grant application to the Federal Office of Rural Health Policy, which was required to focus on EMS workforce recruitment and retention in May 2024. Ours was one of 8 successful applications from across the country, and the grant, which began September 1st of 2024, is set to operate through August 31st, 2029, pending congressional approval of funds on a yearly basis. Through this grant, we're now able to support a full-time program coordinator, Joan, who will speak in a moment, to provide various activities that focus on supporting the education of new EMS providers and continuing education of existing providers, support for billing and coding education to help with agency sustainability, and our HERO grants. Please note that grant funds cannot be used to pay for EMS equipment, which I noted a little bit ago. And now I'm going to turn it over to Joan to discuss the program activities we're able to provide as a part of the Flex EMS Supplement Grant. Go ahead, Joan.
Thank you, Sarah. Can everybody hear me okay?
Yes.
Okay. Hi, everyone. Let me just briefly introduce myself. I'm Joan Field. As Sarah said, last October, I was hired as the Rural EMS Program Coordinator. I live and work in Wheeler County, which has a population of approximately 1,500, 1,600 people, and so is one of Oregon's designated frontier counties. And Spray, where I live, has a population of approximately 160 people, so is very rural. I volunteer with our local ambulance, and I've done that for the past 17 or 18 years. And most of those years as an EMT intermediate, and also most of those years as crew lead. Prior to that, I spent over 7 years at our local medical clinic as their community health worker. And a little over a year ago, I took the training to become a certified community paramedic. But I share my background with you today, so you'll know that I have some understanding of the challenges you face in rural EMS. In fact, I was one of the rural volunteers who responded on behalf of Spray Ambulance to the grant survey and interviews that Sarah mentioned. I think we were allotted, I can't remember the amount of time the phone interview allotted, but I think I doubled it. I had a lot to say. Today's community conversation is to share what we're doing to try to bring the resources to Oregon's rural EMS. But this is a conversation, so we also want to hear from you. If not in our limited time here today, then I encourage you to please reach out to me. I put in the chat earlier as everybody was coming on, but I can do it again if anybody asks, that has my email and contact information. So if you, I don't want you to miss that. So next slide, let's talk about these resources. Let me first say the resources in this project are at various stages of implementation. It's a big project with several components, and it's taking some time to roll out each one. The best way to stay updated on them is to visit our EMS webpage. I try really hard to keep that updated. And also keep an eye out for the update emails that I've started sending. I think that is, our website is going to get dropped into the chat, I believe. And so let's start with the components that are directed at recruitment. So the scholarships, you can see here what our top line there is. This resource has been launched and supports the training of EMT, AEMT, EMT Intermediate, and Paramedic. It doesn't cover EMR, but I'll speak to that later. So far, we've received 10 completed applications. I want to be sure to fully complete the application and hit submit. There's an attestation that the above is true, and then you submit it. I can't process the application if it's not completed. I do have some on there that are not, and I'm reaching out to try to see if people are going to come back on and submit. But once it is submitted, then I can send it on to scoring, and we score it by very carefully by at least 2 people. We score it using a rubric with the standards to ensure that the funds go to agencies with the highest need. And some of the things we look at are, is it in a rural area? Is it a frontier county? Is the agency 100% volunteer? And if it's not, what's the ratio of paid to volunteer staff? This is an important one to me. Does the scholarship benefit more than one agency? What is the agency's budget? And things like that. The online scholarship application is open all year, and the submissions are evaluated when submitted. And based on the score, the application will land in one of 2 tiers. First tier is approved for funding. They've scored high enough that it moves forward, and we work towards funding. Second tier is held for another review towards the end of the grant's fiscal year. This grant's fourth quarter ends on August 31st. So on July 1st, the second tier applications will be reviewed again for possible funding. Many of the applications were so close to the cutoff line, and we want to help as many students as we can. The next one is student barrier removal. This could make a critical difference to a student, so keep this in mind. We haven't received any requests yet, but when they come in, they'll be evaluated on a case-by-case basis. They need to be in training for that. Community paramedic CP training. You see there that we can support 4 students a year, and I believe it comes out to about $2,600 each. And this is for enrollment in an online accelerated CP program. And the student must be affiliated with an EMS agency with the intent to use that certification to further their MIH program. This can also be used to assist with the testing and certification expenses. The application for this is still being finalized, but reach out to me if you have a student ready, because we're close to getting that out there. Leadership peer work group. This is coming soon, and I'm very excited about ways this can be of value to you. Its main purpose is to bring together the EMS agency leaders to discuss best practices in recruitment and retention, share strategies, ideas, but I also see this as a fantastic way for EMS to share limited and precious resources, such as passing forward unneeded equipment or vehicles, sharing information about protocols, or sharing ways you've maintained morale in your crew, or any number of other things you face all the time. There are some additional components such as funding support to attend EMS Leadership Academy, which is 40 hours of training, and other leadership support. This is close to being launched, and I'll reach out soon to find out who'd like to be included in this work group. Please feel free, if you already know that you would like to, send me an email and say, please include me in that email batch, and we'll get you in there. Job boards. This will be launched along with and after the leadership program, because that group will help with the design and function. We want this to be of value and serve the agencies and medics, and that will take some guidance from the EMS leaders themselves. Online EMT course. We've started this, and there are some good things coming from the discussions. Sarah and I made a presentation at a meeting of the Oregon EMS Education Consortium, and from that meeting have started discussions with several community colleges and one university. We're not looking to create an ORH EMT online educational program. Instead, we aim to support existing programs, help them grow, and facilitate collaboration where it makes sense. This is one of the resources that, as it's developed, will be of huge value to rural agencies in particular, as the distance to education in person can be a great challenge for rural EMS students. It's a work in progress, and we'll have more announcements as this initiative moves forward. Next slide. Retention. Hero Grant, helping EMS in rural Oregon. And this is something that Sarah mentioned a little bit about. As Sarah explained, this was a program in existence before this EMS grant, but the grant has allowed us to expand, and this year we were able to support 8 projects. This grant opportunity is offered once a year, and this year's grant cycle opened, as she said, March 21st and closed April 11th. Right now, the 8 agencies who were awarded are in the process of sending me their completed documents. And as long as we receive our second year funding for this Flex grant, we'll have the HERO application open again in approximately March of 2026. I want to mention, I've had several requests for training assistance for EMR certification level. Some of those requests were in conjunction with the EMS scholarship funding, which, as I said, doesn't cover EMR. However, in the HERO grant, we can support EMR training, so keep that in mind. EMS Leadership Academy Scholarship. As I mentioned earlier, this is a crucial way to give training and support to rural agencies that may not have any capacity to help their leadership gain leadership skills. It's also an important way to network with other agencies and to share knowledge in a focused way. This hasn't been launched quite yet, but I'm gathering information and we'll be sharing more on that soon. And this is a personal favorite of mine, EMS Billing and Coding and the Ambulance Billing Peer Network. Again, something that can have a huge impact on rural EMS agencies. If billing isn't being maximized, your agency might not have the funding it needs to survive. So we're hosting and facilitating education for EMS billing and coding, and the first session is coming soon, May 29th. The topic is patient care report documentation for EMS billing. Experienced ambulance billing educator Krista Cuthbert with MedX will present it. Finding my words. I'm very excited about this one. It's a 1-hour webinar class that will help you collaborate with your EMS providers to enhance their charting, making it more complete and detailed, which in turn improves billing and compliance. And I believe a link is being put into the chat that you can go directly to and register if you know that you want to attend that. And in addition, by request, we're forming an EMS Billers peer network to provide a forum for posing questions and sharing solutions, discussing best practices, sharing strategies, whatever you guys need to help each other. This peer group will help guide the topics for future EMS billing education sessions and what resources you would like to see. You can help us understand what you need and how we can support your work. You'll want to attend the May webinar, and in that you will learn about signing up for the peer network. And I'll have more information to share at that time. And please feel free to share that meeting invitation with others who might be interested. I'm working hard to get the word out about these programs and resources, so don't hesitate to reach out to me. Have your peers reach out to me if you think that we have something of value here for them. Okay, that was a lot of information. Again, I'm going to encourage you to visit that EMS webpage. And if you haven't already gotten, I would say 2 to 4 EMS emails, EMS update emails from me already, shoot me an email and ask to be added. And if you have a particular focus, like if you only want to get information about billing or grants, just let me know that. I've been adding people, so there may be some people that have only gotten 2, but I think 4 altogether have gone out. Another reason I keep encouraging you to visit our website is because there are other resources there that are of great help to rural EMS agencies. Next slide. Two things I'd like to quickly highlight are the ORH Resource Hub. The hub is hosted on an Airtable platform and appears on your computer as a spreadsheet. It's a place where both ORH and community partners can submit resources for others to access. I encourage you to check it out. It's becoming a very popular place to share information and resources. And I post EMS things that come across my desk there as well. And the Oregon Rural Health Excellence Award. Oregon's rural health constituents often demonstrate exceptional resourcefulness, teamwork, and creativity. To recognize organizations that demonstrate remarkable dedication to their communities, we invite you to nominate eligible facilities for this award. Categories can be found on the website, but I'm sharing it with you guys now because this year they've added EMS agencies. So we invite you to participate in this recognition program. Nominations must be made by August 31st, and awardees will be honored at the Oregon Rural Health Conference in October. And the details can be found on the website. Next slide.
All right, well, that takes us to our questions and discussions before we go to some ORH announcements and hear from Hero Kids. Please either put your questions in the chat or raise your hand and we can unmute you and have you ask your question live. We have a quiet group here today, Joan.
I expect to get a lot of emails.
And Joan's email address is in the chat.
Yeah, I'm looking forward to it.
Yeah, along with many of the resources that we discussed today. Okay, and we can also, as you think of questions, we can ask them at the very end of the presentation as well after our friends from Hero Kids are able to present. So I'm going to move on to the next slide. Just a few ORH announcements that I wanted to make for upcoming opportunities and events. So ORH, about 2 months ago or so, started biweekly policy update meetings where we're talking about the implications of federal and state policy on rural health. We've had some really great presentations from state legislators, experts in different policy areas. Our next policy update meeting is on May 16th, so that is tomorrow at noon. And I believe the speaker is going to be talking about Oregon's budget forecast and how that is going to play out in this legislative session. So you can register at the link on the slide. There's also a link in the chat for you. May 19th through the 21st, coming up next week, we have our second annual forum on rural population health. Great event that brings together healthcare providers, leaders, community-based organizations, and others to explore and discuss innovative programs and information that's useful in terms of advancing and improving population and community health. That event is in Seaside. And right following on the heels of that, we have our Critical Access Hospital Quality Workshop, May 21st and 22nd, also at the Seaside Convention Center. That event brings together Critical Access Hospital quality staff to talk about reporting and strategies to engage patients and families in their care and all sorts of good stuff. So that event is coming up as well. Our next Community Conversations event, which is just like this one, is going to focus on our Critical Access Hospital, Rural Health Clinic, and Population Health programs. That is July 24th at noon. And then finally, our annual Oregon Rural Health Conference will be held in Bend, October 1st through the 3rd. And that is an event where around, 300-ish people gather and hear a host of topics on improving health in rural communities, innovative programs that are going on to sustain and support our rural healthcare facilities. We get policy updates. It's a really great event. And if you haven't attended before, really encourage you to try to make time to do that. Okay, I am going to, oh, sorry, there was one more slide in between me and Hero Kids. I wanted to share our contact information, Joan's email address and my email address. We're always happy to answer your questions, hear your ideas. We really want this to be a two-way conversation, so please reach out to us at any time. All right, and with that, I'm going to introduce our next speaker, Brittany Taliaferro. Lucas, I hope I didn't butcher your name, Brittany. But I am going to turn it over to you now to talk to us about the Health Emergency Ready Oregon, or HERO. We have another HERO program in Oregon, Kids Registry. So I will let you take it from here.
Excellent. Thank you, Sarah.
You bet.
Thank you all for giving me the opportunity to talk to you about Health Emergency Ready Oregon, or HERO Kids Registry. You can go ahead and go to next slide. So the HERO Kids Registry is the first registry of its kind in the nation. It was developed by the Oregon Center for Children and Youth with Special Health Needs, or OCHN, which is a Title V public health agency. It was built in partnership with Oregon Emergency Medical Services for Children. The registry is housed at OHSU, but it is operated statewide and is available for all Oregon children. And next slide. So to get us started, we're going to show you just a very brief 1-minute overview video for HERO Kids. Go ahead and play the video.
Emma is my little superhero. But if something were to happen and I wasn't there, EMS need to know Emma is autistic and may not respond the way they expect. She might be afraid,
Sorry.
try to run away from them. She doesn't use words to communicate. Having HERO Kids helps me feel prepared and confident that EMS and emergency department providers will understand her needs. In an emergency, every moment counts. Oregon's HERO Kids Registry is a voluntary, no-cost system that lets families and young adults share critical health details that emergency medical services and hospital emergency department providers can quickly and easily access. Saving seconds during an emergency can make all the difference. Learn more or register at www.herokidsregistry.org.
And next slide. So like the video mentioned, HERO Kids Registry is a voluntary no-cost system. And again, it lets any Oregon family share critical information about their child or young adult's health before an emergency. EMS and emergency department providers will be able to quickly and easily access this information. And for those who are familiar, the HERO Kids Registry is modeled after the Oregon Pulse Registry and is operated in much the same way. Next slide. So HERO Kids Registry is for any Oregon child or young adult up through the age of 26. It is especially useful for medically complex children and young adults who have complex or chronic health conditions, developmental disabilities, and or mental or behavioral health conditions. Next slide. HERO Kids Registry gives EMS and ED providers a head start on understanding a child or young adult's medical history and unique needs. The registry shares information that can provide more informed care or comfort. For example, they might learn that flashing lights from a responding vehicle may trigger a seizure. They might learn specific words that can be used to calm the child or young adult, or they might learn that the child or young adult does not communicate using spoken language. Next slide. So how does the registry work? In an emergency, the person calling 911 will give the dispatcher the HERO Kids Registry ID number, if they know it, or they will tell them that the child or young adult is registered, again, if they know that. Once EMS and ED providers know that a child or young adult is registered, or they have enough demographic information to identify them, they can call a confidential provider line, connect through the Oregon Registries for EMS or EMS app, or they can access information through the Emergency Department Information Exchange. The information held within the registry will be available to them in fewer than 90 seconds. Next slide. The HeroKids registry database is secure and HIPAA compliant. It is operated by registry staff who are trained to comply with all health privacy laws. To protect privacy and confidentiality, only the following people can access the registry: the parent or legal guardian who registers the child or young adult, the young adult who self-registers, HeroKids registry staff, and EMS and ED providers who are actively treating the child or young adult. Next slide. To register, families will visit the website using a computer or tablet to complete the online form. Depending on the complexity of the child or the young adult's health, registration should take between 15 minutes and an hour. They may also include provider-signed emergency information forms or protocol letters with the registration. And then in a few weeks after submitting the registration, families and young adults will receive a packet that includes a welcome letter, set of stickers, and a backpack tag. And those you can see in the image on the screen. We encourage families to share the registry ID number with key partners such as the child's school, childcare, and primary care providers. Next slide. So this slide shows you the type of information that can be entered into the registry. These registration forms are family and young adult owned, so they get to choose what information they put in. They can put in as many of these items or as little of them as they want. It can include things like alerts, allergies, comfort items, protocol letters, information forms, factors that impact care, mental or behavioral conditions, technology and equipment, mobility devices, medications, parent and legal contact information, preferred hospital, and safe words. Next slide. Here you can see a copy of the HeroKids registration form. Once they complete it, families and young adults can print a copy for their records. We're recommending that they keep it on the refrigerator so it's easily visible to EMS. And EMS and ED providers can access the registry information again through the hotline, through the app, or through the Emergency Department Information Exchange. Next slide. So like I mentioned, HeroKids registrations are family or young adult owned. This means that healthcare providers cannot create or make changes to any registration. Families and young adults, however, are encouraged to work with their healthcare providers to ensure that the information they're submitting is accurate and complete. Next slide. So you might be wondering, how can you become a HeroKids champion? So you can provide materials to families and young adults. You can encourage families to complete registration as part of their emergency preparedness plan. You can include HeroKids links in your newsletters, websites, other communications. You can also contact us about scheduling short informational programs like the one I'm presenting here today, or invite HeroKids out to community outreach events. We like to do tablings, get out there in the community and talk to people. So if you have those kinds of events and want us there, please reach out. Next slide. And so here are some key takeaways. HeroKids is for all Oregon children and young adults up through age 26. This allows families with children that have varying health needs to be able to register all of their children. They can feel comfortable knowing that if any of their children experience a medical emergency, that EMS and ED providers can quickly and easily access information. By opening up HeroKids registry to any child or young adult, it also helps ensure that it becomes part of routine emergency medical care. And EMS and ED providers can use HeroKids as a tool to guide their treatment for patients up through age 26. Hero Kids is also portable and accessible across the state. So hopefully kids are living big, full lives, and whether they're visiting their family across the state or enjoying a trip to the coast, their registry information is available. Hero Kids is also an excellent tool for emergency preparedness. The ability to list multiple emergency contacts can aid in reunification. And the Hero Kids team would like you to make sure that your teams know about Hero Kids Registry and contact us if you have any questions or ideas or requests for materials and presentations. And we can go ahead and show the next slide, which is our contact information. And if there are folks on the call now that are EMS and you don't have the hotline number, please reach out to this email address here so we can get that to you. I believe we'll now have time for questions.
Yes, thank you so much, Brittany. Really appreciate you sharing that information with us. I think we had a comment in here that said, "This is great. I honestly didn't realize there was a Hero Kids." So we're learning and sharing good information here, I think. Any questions from the audience about either ORH's programs or Hero Kids that you wanna ask? We're here to answer any and all questions. All right. Well, with that, I think I'm going to close us out and give folks 18 minutes back of the noon hour. Really want to thank everyone for joining us here today. We really appreciate it. And again, like I said, we're all here to help provide information, make connections, answer your questions. So don't hesitate to reach out at any time. Thanks so much.
Thanks, everyone.
Thank you.